Welcome to this short video that was filmed in the Interprofessional Simulation Centre at Glasgow Caledonian University. What we will do is demonstrate the equipment, specifically the bed that is used within this clinical simulation lab. Obviously, the first thing you want to do is to ensure that the bed is plugged in at all times and switched on, because the bed has a short battery life. Next thing we want to look at are the brakes. The brakes are in 3 positions but should always be left on red, which means that the bed will not be moved. The other 2 positions are that they can be level or they can be at green. If they are at level, the bed can be moved in a sidewards direction. If the brakes are now at green, the bed can be moved in a forward and back direction. But what you always want to make sure is, once you have moved the beds, that you have left the beds in the red position, and that is that the brakes are on. The next thing we want to look at is the side rails. A side rail assessment will be carried out in any patient that needs the side rails, but the side rails can be in any position. They can be raised up, as demonstrated, or they can be in a lower position. To move the side rails, simply adjust the red knob at the side of the bed and give it a gentle pull, and you can raise or lower the side rails at any time for the patient's safety and comfort. We are able to remove the head and extend the footrest at the bottom of the bed. If we want to remove the headrest at the bottom of the bed, we would like to move the bed forward so that we can get out behind the bed. If we do that, we want to ensure that the brakes are on. And then when we remove the head, we just remove it in one swift movement away and place it in a safe position. There may be occasion that we need extra storage space at the bottom of the bed, and we can extend the shelf out at the bottom. We can place equipment on the shelf, or we can place linen on the shelf as required. The next thing we want to look at is the mattress. These mattresses are specifically for this bed, as you can see, and there's specific information on the mattress about the amount of weight it can take, how to turn the mattress, if we can use it for x-ray, and when it was last cleaned. When cleaning the mattress and the bed, please ensure that the whole bed is cleaned, and that includes cots, bed rails and all surfaces for the bed. There is an attendant handset for each of the beds, which you will need to become familiar with, and it is important that you look at these. So therefore, we're looking at the button to switch the handset on or off. So that is important to familiarise yourself with that button. There is also a CPR button in case of emergencies that we need to flatten the bed. And there is also a CPR button at the side of the bed. Again, you need to familiarise yourself with these. We can move the bed up and down to the optimum position as demonstrated, and we will always leave the bed in an optimum position for that patient. We can now show you that we can move the bed down and adjust the height. Again, you have to familiarise yourself with this. There's also a patient handset that the patient may use for their own comfort. There is a lockout button, because sometimes we would not want the patient to move the bed in certain positions. So again, you need to look at what these amber buttons mean. These amber buttons mean that the bed is locked out, so that the patient, even if they have the handset and they want to adjust it, they are able to adjust the handset. If we want to unlock it, we just press the button again, and the lights will change from amber to clear, and therefore the patient can move the handset themselves. So they can raise in a sitting position to make themselves comfortable, if that is appropriate. And also sometimes it might be even appropriate for them to lift their knees at the bottom of the bed so that they're in a comfortable position. If the patient is allowed to do this, then you will need to demonstrate this to the patient. Sometimes we need to move or transfer a patient in the bed. Obviously, we need to gain consent for this, but you would not do it this way. You would not sit in a patient's bed. The next thing we want to look at is, if we are transferring the patient, we remove the plug safely from the back of the bed. We wind it up and leave it in a safe position so it will not trail along the floor. We ensure that the bed rails are up, that the patient is aware that they are about to be transferred. As you can see at the moment, the brakes are on red on the bed. We would change the brakes to the position that we would like to move the patient. Therefore, we're on green so we can move back and forward, and we gently move the bed. Now you're going to look at the troubleshooting for the lockout function of the handset, and you need to be aware of this and look at it.
So this video just demonstrates the lockout feature of the Arjo Huntley Enterprise 5000. So if we press the lock button and then press one of the ways we're going to move it, you'll see the light stays on and it's an orange light. Now if we selected the bed up and bed down and pushed an arrow, nothing will happen because it's been locked out. So now we can unlock that by pressing the lock key and pressing the button again. The light's gone. So now if we push the up down mode, we can see that's a green light, and now the bed will go up and down.